if you've ever had a stroke, it is the most scary period of your life because it is at that point in time where you have loss of control of certain parts of your body. Imagine all of a sudden you're not able to speak, or you've lost control of your movement of your arm, loss of sensation of your arm or your lower leg, or just one side of your body. You might also notice that your mouth is turned in the same direction, usually drooping downwards. You might find that you've got loss of balance. And some people find that they might have had a warning sign or symptoms before this was about to occur, like they might have had fainted, or maybe headache or dizziness, or this out of body experience, this weird sensation that something is about to happen that they cannot describe, but it's something that's beyond their control. And in most cases, some people don't actually have any symptoms. They don't actually know they've had a stroke because it depends on what part of the brain has been affected and if that part of the brain provides any critical function to the body. So a lot of people have strokes without actually realizing that they've had stroke. So you might have had one stroke that you recognize because of the symptoms, and then 6 months later you might have had a second stroke, but in between that 6 months you might have actually had two strokes and did not know you had a stroke. And some people can actually have stroke in their sleep. So if you're sleeping, you can have a stroke and you actually sleep through it and not actually realize you had a stroke. So it really depends. There's a minor stroke, there's major strokes. It depends on what part of the brain is affected. And there are different types of strokes depending again on what part of the brain is affected. And what the part of the brain is affected would determine what kind of symptoms that you have. So if you have a stroke on the left side, you might have symptoms on the right side. So if you're right-handed, that's a problem. If you have a stroke on the right side, you might have symptoms on the left side. So if you have a stroke in a part of the brain that controls your bladder, you might find that you're losing control of your bladder functions or control of your bowel functions, weakness of your legs, where you lose your mobility and the ability to weight bear or balance on your legs, for instance. In terms of stroke, again, there's two main types. You've got what we call TIA, which is a transient ischemic attack, where basically it's a stroke that usually lasts for 24 hours. Majority we have stroke symptoms that would have lasted for a few minutes. Could be like up to 15 minutes, for instance. Again, it could be similar symptoms such as slurring of speech, facial weakness, numbness, loss of control of one part of the body. You do not usually lose consciousness with a TIA, and the person is usually completely back to normal, within 24 hours, and that's a mini stroke. But then you've got your major stroke where symptoms linger beyond the 24 hours, and it's quite critical because if you're having a stroke, you usually need treatment, usually because one of the most common causes of stroke is a blood clot. So usually you need treatment. Correct me if I'm wrong, but ideally within an hour, you need the clot busting drug to break down the clot to reduce chances of permanent damage to the brain, which can be debilitating for the person.